Welcome to NobleNest Veterinary, where every paw matters. Because here, it's not just vet talk, it's family. They used to leap with joy, run circles around you, and never tire. But now your dog moves slower, sleeps longer, and sometimes winces in silence. Aging is inevitable. But suffering doesn't have to be. From joint pain and cloudy eyes to strange behavior or forgotten commands, these could be signs of deeper health issues. Most owners miss them until it's too late. But not you, because today you'll learn how to spot the warning signs early, manage them with love, and give your senior dog the comfort, dignity, and care they've given you every single day of their life. They say dogs don't live as long as us because they already know how to love perfectly. But even the most loving hearts grow old. You might notice the changes slowly. Your once energetic pup now prefers long naps over long walks. Maybe they're not as responsive when you call, or their eyes seem cloudy with time. These aren't just signs of aging. They could be symptoms of real health issues that need your attention. Senior dogs, typically age 7 and above, face unique medical challenges. Just like aging humans, they're prone to arthritis, cognitive decline, kidney problems, heart disease, and dental decay. The sad truth: many owners dismiss these symptoms as normal aging when in fact they're treatable, manageable conditions if caught early. Let's take arthritis, for instance. It's not just a little stiffness, it's chronic pain. Your dog might struggle to stand, climb stairs, or even lie down comfortably. But with the right supplements, pain relief, weight management, and gentle exercise, their life can improve dramatically. Or consider canine cognitive dysfunction, doggy dementia. If your senior dog seems disoriented, forgets routines, or starts pacing at night, it could be more than just old age. Specialized diets, medications, and mental stimulation can help slow the decline and preserve quality of life. Even dental problems, so often overlooked, can lead to severe pain, difficulty eating, and even organ damage. Regular vet checks and dental cleaning can add years to their life. The most important thing: your attention, your love, your willingness to notice the subtle shifts. Because dogs don't complain, they endure. But they count on us to see what they can't say. So if you have a senior dog, don't wait. Regular vet visits, blood work, proper nutrition, and joint support aren't optional. They're essential. Your dog may be older, but their heart still beats for you, and they deserve to live the rest of their life feeling safe, seen, and pain-free. As dogs enter their senior years, typically around age 7 or older depending on the breed, they begin to experience a natural decline in physical and sometimes cognitive function. But here's the most important thing every dog owner should understand: many of the changes we assume are just normal aging are actually signs of treatable health problems. For example, if your senior dog starts moving slower, limping after rest, or hesitating to climb stairs, it's easy to think, oh, they're just getting old. But more often than not, these are red flags for joint issues like arthritis or hip dysplasia, which cause chronic pain and inflammation. Left untreated, these conditions worsen over time and can greatly diminish your dog's quality of life. Another common sign people miss is increased water consumption or more frequent urination. It may seem harmless, but it can point to kidney disease, diabetes, or Cushing's disease, all serious conditions that need medical attention. Dogs are experts at hiding pain and discomfort, so the early signs are often subtle: changes in behavior, sleep patterns, appetite, or even how they interact with their family. Senior dogs may also develop heart disease, which might first show up as coughing, fatigue, or fainting after mild activity, or vision and hearing loss, which may make them appear anxious or unresponsive. But these too can be supported with environmental changes and medical care. The biggest danger is that many of these health problems mimic the symptoms of normal aging, so they often go undiagnosed until the condition is advanced or irreversible. That's why it's vital for pet parents to pay close attention and not dismiss anything as just old age without a proper veterinary evaluation. Being proactive and observant, especially during your dog's senior years, can literally save their life. Spotting a problem early means faster, more effective treatment, less pain, and more time with your beloved companion. Aging is natural, but suffering doesn't have to be. Not when we know what to look for and how to respond with love, care, and medical support. One of the most common and impactful health problems faced is arthritis, a chronic condition that causes inflammation and pain in the joints. It's not just a little stiffness or slower walking. For many dogs, arthritis can be deeply painful, mobility limiting, and emotionally distressing. And what's heartbreaking is how often it goes unnoticed. Dogs can't tell us they hurt. They don't whine or cry until the pain is severe. Instead, they subtly change their behavior. Your dog might start avoiding stairs, hesitating to jump into the car, taking longer to stand up after resting, or showing stiffness after a walk. Some dogs may lick or chew at the joints that hurt. Others may simply lose interest in play or walks, not because they don't want to, but because it hurts too much. As dogs age, they can begin to experience cognitive decline, a condition known as canine cognitive dysfunction, CCD, which is similar to Alzheimer's in humans. It's a progressive brain disorder that affects memory, learning, and awareness, often causing confusion, anxiety, and personality changes. Signs include pacing, staring at walls, getting lost in familiar places, disrupted sleep patterns, house soiling, and a general sense of disorientation. Many owners mistake these changes for normal aging, but they're actually symptoms of a medical issue that can and should be addressed. With early veterinary diagnosis, dogs with CCD can benefit from brain-supportive diets, omega-3 rich supplements, medications like selagilin, and mental stimulation activities such as puzzle toys and short training sessions. A stable, stress-free routine and calm environment also help reduce confusion and fear. While CCD can't be cured, it can be slowed, and with the right care, your dog can enjoy more peaceful, connected moments with you, even in their golden years. Dental health is one of the most overlooked aspects of a senior dog's well-being. Yet it plays a critical role in their overall health and longevity. As dogs age, plaque and tartar buildup can lead to gingivitis, periodontal disease, loose or broken teeth, and painful infections. Unfortunately, many owners don't realize their dog is suffering because dogs rarely show obvious signs of dental pain. They simply eat less, chew on one side, or avoid hard food. But the consequences go far beyond the mouth. Infected gums can enter the bloodstream and damage the heart, liver, and kidneys, leading to serious systemic illness. That's why regular dental checkup, professional cleanings, and at-home care like brushing and dental chews are so important, especially for seniors. Maintaining your dog's oral health isn't just about fresh breath. It's about preventing pain, preserving quality of life, and potentially adding years to their life. A healthy mouth equals a healthier, happier dog. Dental health is often one of the most neglected aspects of senior dog care, yet it plays a far greater role in a dog's overall health than most owners realize. As dogs age, years of plaque and tartar buildup can lead to painful conditions such as gingivitis, periodontitis, tooth abscesses, broken teeth, and even tooth loss. These issues don't just stay in the mouth. They can lead to systemic infections that affect the heart, liver, and kidneys, significantly compromising your dog's quality of life and lifespan. Many pet parents miss the signs because dogs rarely show obvious discomfort when it comes to dental pain. Instead, they quietly endure it, sometimes refusing to eat crunchy food, dropping food while chewing, pawing at their mouths, chewing only on one side, or simply becoming more withdrawn or irritable. Bad breath, often dismissed as normal in dogs, is usually a sign of a deeper problem brewing beneath the gums. Regular veterinary care is the cornerstone of keeping senior dogs healthy, comfortable, and living longer lives. As dogs age, their risk for serious health conditions, like kidney disease, heart problems, arthritis, cancer, cognitive decline, and endocrine disorders, rises significantly. The problem is, these issues often develop gradually and silently. A dog might not show obvious signs of illness until the disease is in an advanced stage, when treatment becomes more difficult and costly. That's why routine vet visits become more critical than ever in a dog's senior years. While annual checkups may be sufficient for young, healthy dogs, senior dogs have seen the vet at least twice a year, even if they appear fine. These visits allow your vet to perform a full physical exam, run blood work, check organ function, monitor weight, screen for tumors, assess dental health, and catch early signs of disease, often before symptoms become visible at home. Early detection can make all the difference. For instance, subtle changes in blood work could reveal early kidney disease, which can be managed through diet and medication before it becomes life-threatening. Slight heart murmurs can be monitored before they evolve into full-blown heart failure. Changes in behavior or mobility might lead to an arthritis diagnosis that, with prompt treatment, drastically improves your dog's comfort and ability to move. Regular vet care isn't just about fixing what's broken. It's about preventing problems, easing suffering, and extending your dog's quality of life. Beyond the medical side, regular vet visits also give pet parents a chance to ask questions, update care routines, and ensure that their dog's changing nutritional, physical, and emotional needs are being met. Aging is a complicated journey for any living being, but your dog depends entirely on you to advocate for their health. They can't tell you when their kidneys start failing or when their joints ache more than usual, but a good vet can spot the early red flags if given the chance. Think of it this way: regular checkups are one of the most loving and impactful things you can do for your senior dog. They're the moments where prevention becomes protection, where early action becomes years gained. And for a creature who's given you nothing but unconditional love, loyalty, and joy, that care is the very least they deserve. Your senior dog may be aging, but with proper veterinary support, they can continue to live with dignity, vitality, and happiness well into their golden years. In the end, it's not the number of walks taken, or toys chewed, or tricks remembered that matter most. It's the quiet moments. The slow wag of a tired tail when you walk into the room. The way they lean into your hand just to feel close. The trust in their eyes that says, "I'm still here. I still love you." Growing old doesn't make them any less your dog. It makes them more your heart. And while we can't stop time, we can make every single day count. With love, awareness, and a little extra care, we can turn their final years into a gift, not just for them, but for us, too. Because there's something deeply beautiful about loving a dog in their senior years. It's not about chasing balls or leaping fences anymore. It's about sitting beside them as the sun sets, knowing you've done everything you could, and feeling them breathe easy because of it. That's real love. That's what they've always given us. And now it's our turn. In the quiet moments of life, when the world slows down and you find your old dog curled at your feet, it hits you. They're not just a pet. They're part of your soul. They've been there through the heartbreaks, the laughter, the years of change. They've aged as you have, silently, loyally, asking for nothing but your presence in return. And now, as their muzzle turns gray and their eyes grow softer, they're facing a part of life that is both beautiful and fragile. But aging does not mean fading. It doesn't mean giving up. It means adapting. It means loving differently, more patiently, more attentively. Because every moment still matters, every slow walk, every gentle cuddle, every tired sigh beside you. They may not bound across the yard like they used to, but their heart beats just as strongly for you. And in these final chapters, your love matters more than ever. This is the time to become their voice, their comfort, their healer. To catch the signs others might miss. To soften their world. To give them the vet visits, the softer beds, the joint support, the extra care they may not know how to ask for. Because what they gave you their younger days, joy, protection, loyalty, unconditional love, you now return in quiet gestures of compassion. That's the unspoken agreement. That's what it means to be their person.